right, welcome to this online presentation. We're going to be discussing some new treatment options for chronic pain, specifically non-drug treatment options. And what we're going to be discussing is the new HFX high-frequency 10 kilohertz spinal cord stimulator system. And we're going to be working with patients to help offer them this treatment. A little bit about me. I specialize in the treatment of chronic pain. We do a lot of low back, neck, sports injuries, work injuries. You know, we work in conjunction with many other specialties. I'm an anesthesiologist specialized in pain management by training, but we collaborate with orthopedic, neurosurgery, neurology. We all work together. I have a large part of my practice set up through NYU Long Island. I'm also in Northwell, and I'm also at Mount Sinai, South Nassau. I originally trained in the city at Cornell, Columbia, Sloan Kettering, and Hospital for Special Surgery. But enough about me. Let's move on a little bit about the practice. So I'm located in Garden City, also located in New Hyde Park. And the point of this slide is to say that we're here to really target the source of the pain. And whenever possible, we want to do treatments that allow us to get to the source and block it. And by doing that and using these kinds of technologies, hopefully we can help to get people off medications such as opioids and things that can be habit forming and with so many side effects and ill effects. And I'd like to thank Nevro for collaborating with me and putting some of these slides together and putting this talk together so that we can help to educate people about this new technology. So everybody has experienced pain at some point in their life. Essentially, pain is meant to be important sensory information to help keep you out of trouble, but sometimes the brain interprets pain out of control. We know that nerves carry the pathways for pain throughout the body, and we know that the brain interprets that pain, but how people experience it and different kinds of injuries can vary quite a bit. And while pain is sometimes easy to describe, you know, the physical part of it, a lot of times the mental, emotional toll of pain and can be as much of a problem as the physical pain itself. When pain goes from short-term to long-term, usually 3 months is what we would consider chronic pain, you know, then you start to have more side effects, such as emotional depression, anger, anxiety over the pain. So really it can affect the whole body if left untreated and crosses into that chronic territory. So pain is very prevalent in the population. Roughly 8% of adults have some form of chronic neuropathic pain, whether that be low back, whether that be chronic joint issues or neuropathy. The number one diagnosis is chronic low back pain, and estimates are that the cost of this pain, and this includes treatment costs, missed work costs, this is a $600 billion a year issue in the United States. That's pretty significant. So patients usually start with less invasive therapies and treatments. So we're going to be getting to spinal cord stimulation and educating specifically on that. But that's never a first step. Normally, you're going to try some pharmacological therapy. You're going to do the right things with your lifestyle, try and lose weight, exercise to whatever extent you can. Undergo physical therapy. Then if those things don't work, you're going to end up seeing someone like me. I do the nerve blocks, the epidural injections, the targeted procedures that are meant to get to the source of the pain and help alleviate it. And there's a good number of people, I would put it at about 2/3 of people, at least specifically in the chronic low back domain, do respond to these injections, and we're able to help them and stop at that point. However, for the patients where either they've had injections, they don't work, or they've progressed to surgery, and they have not had success, then you become a candidate for something like a spinal cord stimulator. So, what is a spinal cord stimulator? Essentially, it's an implanted device in the spine that delivers an electrical signal, and that electrical signal disrupts the pain pathway before it can get to the brain. So, all pain signals from your body have to go through the spinal cord in order to get to the brain. And if you can interrupt that pathway, you can knock out the pain before it gets to your brain, and therefore you don't experience the painful signal. So there's no drugs involved in this. This is purely electrical impulses created by the brains of the device, and it creates that electrical signal in the spine that helps to block the pain. Now, if you've talked to somebody who had a spinal cord stimulator implanted, say 5 years ago, the experience they had is very different than what we're talking about today. So you have to be careful when you hear, oh, so-and-so had one of those, and they said they didn't like the way it felt. Well, conventional stimulation, what we were doing years ago, was okay for some people, but conventional stimulation made you feel like you were having a buzzing or a tingling in your back or in your leg. And again, some people like that feeling and it was better than the pain, but now we have newer waveforms, newer ways of delivering this electrical signal to the spine. And what's unique and proprietary to the Nevro system is that it functions at a very high frequency. So they pioneered high frequency stimulation. So just to give you an idea, like previous stimulators were in the 2 to 1200 hertz range. Now this therapy is in the 10,000 hertz range. So you're talking about an electrical signal that's cycling at 10,000 times per second. That is so fast that you do not perceive it. So you don't feel that buzzing or tingling that you might have felt with a traditional stim. This therapy is approved for lower back, for leg pain, and also for diabetic neuropathic pain. This is a minimally invasive procedure. It starts out with a trial. The trial is temporary and fully reversible, so you're not married to the device until you've really had a chance to test drive it and see. In our world, we consider success knocking out 50% of the pain, and this kind of device is certainly capable of giving the majority of patients a 50% reduction in their pain. So let's get into the specifics a little bit about this particular therapy and HFX, as it's termed, in relation to diabetic neuropathy. So this is the only system out there approved for diabetic neuropathy. Now, this can be used to treat low back pain, can be used to treat leg pain, failed back surgery. So there are multiple indications, but this is the only system that has the approval of the FDA specifically for treating peripheral diabetic neuropathy. Now, this system was not invented just for diabetic neuropathy. There's 70,000 people walking around with these devices in them for low back and leg pain. And now, in addition to those indications, we're able to open the door for patients with diabetic neuropathy specifically. As we talked about, you're going to be able to try this out. So you're not committed to the device with the trial. It's simply a chance for you to put it in, walk around with it, and see how you feel. Now, what's entailed in putting something like this in? This would be done in an operating room in a sterile environment. It's twilight sedation. It's done through a needle. So it's not any more invasive in your back than getting an epidural steroid injection. And most likely patients have had shots before they get to a spinal cord stimulator trial. So in terms of how invasive it is to put it in, you're going to go home probably within an hour of getting the device for the trial. If you do well with the trial, then we would have a surgeon do a permanent one. Again, same day procedure, minimally invasive. You're talking maybe like a 1-inch incision to put the battery in. During the trial, the battery is external, so it's outside of you, and you walk around with it. The permanent one would be completely under the skin. That says that paresthesia independent. Let me explain that a little bit. So you don't have to necessarily feel the device working. It works in the background without the usual tingling feeling of a traditional spinal cord stim. The other good feature with this is you can use it 24/7, sleeping, driving. You really don't have to turn the machine off. You do need to charge it. It's rechargeable through the skin. So depending on how much you use it, just like your iPhone, you're going to have to charge it up based on how much usage you have. So this is a good long-term option, and the studies have been done going out several years on these patients. So this is not like an epidural where, 3 months later, you're going to say, hey, doc, it wore off. This is meant to be a long-term solution to the pain. So a number of large clinical trials have been done with this device compared to traditional spinal cord stim. A significant number of patients, approximately 1.6 times, reported more relief with this particular system at the 2-year mark, and that was a significant difference. So this technology, the HFX system that we're talking about, is really the most advanced spinal cord stimulator on the market right now. It's got significant relief of back and leg pain. It can be programmed in other ways. So just because the technology has the 10 kilohertz ability, your representative would be able to program in other waveforms and other programs. So it's very customizable to where your pain is and what the intensity of your pain is. There's no drugs, hence this is not addictive, doesn't affect your brain, doesn't make you drowsy, doesn't make you constipated. And again, you can trial it, try it out, see if you like it. If you don't like it, taking it out is as simple as just pulling the tape off in the office. And most patients wouldn't go on to do the permanent unless they were satisfied with the temporary. So what's the process for doing a trial? So obviously you're going to start with the physician, see if the person like myself feels like this is the right fit for you. Again, the typical indications would be somebody with chronic low back, leg pain, failed back surgery, and now diabetic neuropathy being the new indication. Usually the trial lasts for about a week. I usually trial about 5 or 6 days, which is enough time for patients to really decide if they feel like it's good for them. And then after the trial, if you feel and the physician feels that you had good results, the temporary electrodes are removed, and then we refer to one of our surgical colleagues who would specialize, somebody who does this often and puts in these for a living. So we would send you off to a specialist surgeon to do the permanent implant. Again, that's a same-day procedure usually. You'd be in and out within a couple hours of the procedure. So conclusions, there's a lot of chronic pain out there. really no need for people to suffer if we have so many new modalities out there. There are a lot of treatments to try before you get to spinal cord stim. So this is not necessarily the thing you would jump to first, but the idea here is to educate, let patients know that these kinds of devices exist, and also to kind of specifically point out that HFX is the first approved for diabetic neuropathy. So a whole new world of options for people that up until now really were just pigeonholed to medications and all the side effects that go with that. This device is different than some of the other stimulators out there. So, make sure you're educated on what kind of devices are being offered to you. There are differences between them. And the placement, while the same for most of them, the results can vary depending on what kind of technology you have. So important to ask the right questions, communicate with your doctor, bring this up if this is something you're interested in to see if you're a candidate. And I hope you found this overview helpful, and I'm happy to answer any questions that come up when I see you in the office. Thank you for your time.